So in future sessions, the client agreed to try to work on those trauma memories, and we prioritize them as an exposure hierarchy. So you can read about exposure from a behavioral perspective through cognitive processing therapy or prolonged exposure therapy. There are different ways that you can do exposure. Can be written, it can be oral, it can be recorded, and the person listens to recordings. But because of her journalism and communications background, she felt like the way that she would like to approach that was through written exposure. So we agreed that we would do several weeks of written exposure and have it be time limited. So she didn't have to feel like this was going to go on forever, but that we would do 2 weeks for each traumatic event. And I had her sort of rate the level of distress that each of the traumatic events currently brought up for her. And so the lowest level of anxiety was that teenage attempted rape. The second one was the combat exposure, the distressing things that she had been exposed to as she traveled with her combat unit. The third was the recent attempted assault by her supervisor. And the fourth, the most distressing one, was the rape that she experienced in Afghanistan. So I gave her a prompt based on the cognitive processing therapy prompts for writing about the traumatic event, to write about the traumatic event with as many details as possible, and also include how you feel like this experience affected your thoughts about yourself, others, and the world. The idea was she would write about it outside of session and then come to session and read the account out loud. And the first session, she had also not followed through with doing that, which again is super common with trauma survivors. And so we explored what got in the way of her doing that in a non-judgmental way. And we actually started the process of writing about the event in session just to give her a start on doing it. So she came back the next session and ongoing sessions, and she would read the account out loud. I would validate her experience, her emotions. And after the emotion had started to settle down a little bit, I might ask some questions or give some feedback about elements that seem to be missing or lacking emotional description. And then each time I would ask her to go home and rewrite that narrative for a second week with more emotional engagement. And in that second week, to read the account out loud to herself, preferably once every day. So we did this with all 4 of those events in the hierarchy. You don't necessarily have to talk about every single traumatic event, especially when you're talking to somebody who has multiple traumatic events. With her, it seemed like that was a time limited enough approach to have 8 or 9 weeks focused on exposure. But I certainly have had clients where we either purposefully choose not to go into every traumatic event because there are too many, or the person starts working through the hierarchy and may experience enough improvement that we don't need to keep going. The main difference between traditional exposure and ACT-based exposure is that traditional exposure is more based on a anxiety, habituation, and attenuation. In an ACT model, we can ask for subjective units of distress, for example, as part of exposure, but we're doing it really for awareness and mindfulness, not looking for that number to go down over time. Because from an ACT perspective, we don't believe that people necessarily have control over the level of their emotional response. And there are some things like guilt and shame or grief that may not ever go down. And that's okay. From an ACT perspective, we want to work with the person to be able to live and move forward even in the presence of those experiences.